Hello, I'm Lynn Nguyen, Associate Medical Director for Redfield Medical Direction. This will be a short talk on oxytocin, a medication widely used in childbirth. You might know oxytocin as a naturally occurring hormone in the body. We'll be talking about the synthetic medication form that helps with labor and other childbirth needs. Oxytocin works by attaching to specific receptors in the uterus, which helps increase calcium levels in the uterine muscle cells. This calcium influx causes smooth muscle contractions in the uterus, making it extremely useful for stimulating labor and helping with uterine contractions after delivery. Oxytocin is commonly used in three main situations. In the hospital, physicians will use it to start labor, such as in cases of preeclampsia, or to strengthen labor if the natural contractions are too weak or irregular. Lastly, oxytocin plays an essential role after delivery by stimulating sustained contractions to minimize and treat heavy uterine bleeding. Since pre-hospital deliveries are well within the EMS scope of practice, it's important that you are familiar with using oxytocin after delivery. There are situations in which oxytocin should be avoided, but those are mostly limited to specific cases in the hospital. In the field, you'll be mainly using oxytocin to control bleeding that occurs after delivery to prevent hemorrhagic shock. The dose of oxytocin is 10 units IM. Remember that oxytocin stimulates contractions of the uterine muscles. When the uterus contracts, it also compresses the blood vessels in the uterine wall, essentially clamping them off and minimizing blood flow. Oxytocin also strengthens the uterus's ability to stay contracted and maintain the compression on the blood vessels. The most common side effects of oxytocin are hypotension and tachycardia. These also happen to be signs of hemorrhagic shock, which is of much greater concern. If your patient just delivered and has active vaginal bleeding, give the oxytocin even if she has low blood pressure or tachycardia. You'll probably end up actually improving the blood pressure and heart rate as the oxytocin causes the uterus to tamponade itself. In summary, oxytocin is a drug you can use in the field for the treatment and resuscitation of postpartum hemorrhage. It works by attaching to receptors of the smooth muscle in the uterus, triggering an increase in calcium levels in the smooth muscle cells. This causes contractions of the uterus, making it extremely useful for stimulating labor and controlling postpartum hemorrhage. If you have any questions, this is my email address and phone number. Please don't hesitate to reach out at any time.